they're the unsung heroes of nursing. Public health nurses are now working behind the scenes to keep us healthy and safe.
Yeah, they're tracking the flu epidemic in our schools and providing care for those in need. But what we'll need soon is more of them.
When you think of nursing, these are probably the images that come to mind. Critical care cases where nurses are springing into action to save lives.
Una semana? Una semana, sí.
But in this small clinic space in the Carroll County Health Department, nurse practitioner Cindy Marucci Bosley might argue they're saving lives too.
Our goal is to serve every single person in Carroll County. Whether they realize it or not, they're really all a client of the health department.
Marucci Bosley is the director of nursing for the county. She's been a public health nurse for 35 years.
It's part being a nurse, it's part being a social worker, it's part being a teacher, it's part being an advocate, and it just fit in perfectly where I wanted to be nursing.
But she's seen a shift in her decades. Now she says there are fewer public health nurses and fewer programs to help bridge the gap. They currently help the under or uninsured through 4 safety net programs: dental, reproductive health, HIV, and child immunizations. But they've lost 20 programs and 20 nurses. And Marucci Bosley, citing a recent study, worries about the future.
Over 40% of all of the staff that are currently working in health departments are over the age of 55. And the problem is we don't know who's going to replace us.
The salary is 2/3 of what the private sector pays. There's little room for advancement, and the jobs aren't glitzy or glamorous. But that didn't discourage Jean Flutka.
I was a veterinary technician. I really love medicine and teaching and things like that, and I just thought this would be my opportunity to do it with humans.
Flutka is the newest member of the nursing team. It was an internship at the health department that sparked her interest in public health. She's tracking trends in communicable diseases and working with HIV patients.
You get to educate people, you get to help identify trends in the community and things like that, and provide for the greater good of the community.
Public health runs 4 programs. So what happens if more nurses like Jean don't join their ranks? That keeps Marucci Bosley up at night.
I think the public would suffer in that, number one, we do have those safety net programs. If we were to stop our reproductive health program, there'd be 1,200 people who would have no place to get care. And that is very concerning.
While she's concerned about the future of public health nursing, she knows it takes a special kind of person to do the job.
For someone coming to public health, it has to be something where they realize that they are not going to necessarily get the highest salary, but perhaps they're going to get a little bit more out of it personally because they feel like they're making a difference.
And that's why you stayed, right?
And that's why I stayed.
Now they're hoping to reach prospective nurses through community college programs like the one Jean Flutka came from. Jamie?
All right, here he is, meteorologist Mike Taylor. All right, timeline is I'll be waking up in the morning.
Yeah,
I don't know.
As you wake up in the morning, we're going to have rain-snow mix, more rain than snow. And mainly because of the temperature, my friend. Look at today's high temp, 71 degrees.
So that helped us.
Yeah, oh yeah, that helped you because it's going to keep the ground temp very warm. So any snow that we'll see, it's going to melt on contact. If anything, while it's falling, especially with the heavy rain, could slow you down if you're on the roads during that time frame, but that's about it. Pretty much uneventful, low event as far as what we're expecting with the snowfall impacting our commuting. So 71 degrees for today's high temp after a morning start of 42. Normal for us, 61, so 10 degrees above average. We'll call it rare air by springtime standards compared to how things have been as of late. So we're holding steady at 66, still well above the freezing mark at this point. Winds from the southwest at 11 miles per hour. That'll keep us on a warmer note. Therefore, for the rest of tonight, as the moisture pushes in, the rain that is, we're going to see those temperatures climbing, or I should say falling, back into the 50s and going into 2 a.m. and 4 a.m. That's when the rain starts to push in and temperatures will begin to drop by about that point. So speaking of the rain, we don't have much on radar right now. This is just some ground clutter you see here, but most of the rain still just moving in through Pennsylvania at this point. But as we widen the scope and look west, you'll see where the energy lies. Now, we have an area of low pressure to the south. That's bringing moisture in our direction. And you can see the cold front with the rain and also the snow changeover just now reaching